My name is ReShonda Taylor. I will be performing my full head to toe assessment for Fall 2025 with Dr. Buford. This is my patient, Brianna. Before starting this assessment, I want to do a brief scan of the room. Okay, these are my supplies. To begin this assessment, we'll start with the skin, looking at the face, head, and neck. For the sake of patient privacy, the posterior interior of the chest and abdomen was performed off camera before recording. Now, starting with the skin inspecting, it is normal for ethnicity. The texture is smooth, the moisture is dry. Skin turgor is intact. There is no edema. There are no lesions, bruises, scarring, or nevi. The temperature is also warm. We will now inspect the head. The head is normal cephalic. It is aligned midline and it is symmetric. I will now inspect and palpate the scalp. The hair is evenly distributed across the head. The texture is coarse. The color is black. There are no masses, no tenderness, no deformities, no infestations or depressions, and no lesions. Now we'll palpate the temporal arteries. The temporal arteries are 2+ bilaterally, no tenderness to palpation. I will now palpate the lymph nodes. I'm going to turn it this way, starting with the preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, supraclavicular, and there's no tenderness noted, no nodules as well. Now we'll assess the TMJ. Open and close your mouth. There's no subluxation, no crepitus, no tenderness. And now I will assess cranial nerve number 5, trigeminal, starting with motor, palpating the cedar muscle. Okay, bite down for me. Open up. Okay, motor is intact. I will now assess sensory. I want you to close your eyes and let me know where you feel my touch.
Forehead, nose, chin, cheek.
Good. Sensory is intact. We will now assess cranial nerve number 7, facial. Close your eyes really tight. Raise your eyebrows. Smile. Frown. Pucker your cheeks. Pucker your lip. Good. Cranial nerve number 7, facial is intact. Now we will assess the ears. The ears are equally and symmetrically aligned on the side of the patient head and appropriate size for patient size head as well. We will now palpate the tragus and the pinna. There's no tenderness and no nodules to palpation. I will now assess the auditory canal and the tympanic membrane with my otoscope. Good. Good. The tympanic membrane is pearly gray and the auditory canal is here. We will now assess cranial nerve number 8, vestibular kosher by performing 3 hearing tests, starting with the whisper test. You'll feel my touch. I want you to repeat the word I say.
Cat, dog,
Good.
chocolate, milk.
Good. No hearing loss noted. I will now perform the Weber test by placing my tuning fork in the middle of your head. You let me know if the sound is equal or greater on the left or the right side, okay?
Equal.
Good. Weber test is normal with no lateralization. I will now perform the Renee's test. With this, I'll place my tuning fork on the mastoid bone and in another area. You let me know if it is greater on the area 1 or area 2. 1, 2.
2,
Good. 1, 2.
2,
Good. Renee's test is normal with air conduction greater than bone conduction. We will now assess the eyes, looking at the lashes, brows, and palpable features. The facial hair is symmetric across the face. The facial features are symmetric as well. I will now assess the sclera and conjunctiva. Can you look up for me? Good. Sclera is white. The conjunctiva is pink with no redness, no lesions, and no drainage. Now it says cranial nerve number 2, optic. For this, I want you to cover your right eye and read the last line for me.
LTLPH.
Good. And now your other eye.
LTLPH.
Good. Vision is 20/20 bilaterally. We'll now assess for peripheral vision. I want you to cover your left eye again and then tell me how many fingers I'm holding up.
2, 2, 1, 2.
Good. Now your other eye.
2, 2, 1, 2.
Good. Peripheral vision is intact. We will now assess cranial nerve number 3, ocular motor. Would you look straight ahead for me? Good. Good. Pupils are equal round and react to light in 3 millimeters in size bilaterally. We will now assess for accommodation and convergence. I want you to follow my pen line with your eyes. Accommodation and convergence is intact. We will now assess for cranial nerve number 3, oculomotor, cranial nerve number 4, trochlear, cranial nerve number 6, abducens, using the 6 cardinal fields of gaze. So I want you to follow my pen line, okay? Good. Eye movement was symmetrical and coordinated. Cranial nerves 3, 4, and 6 are intact. Now we will perform an ophthalmic exam, looking at the red light reflex as well as the internal eye structures. I want you to look at it for good. 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 The red light reflexes are present in both eyes. And the retina veins and arteries show no narrowing, no enlargement. They are appropriate in size. There's no hemorrhaging, no lesions, and no eye drainage. The optic nerve is round and has sharp disc margins. We will now assess the nose. Upon inspection, it is straight in midline. I will now assess cranial nerve number 1, olfactory. For this, I want you to close your eyes and let me know what you smell on this cotton swab.
Alcohol.
Good.
Alcohol.
Good. Cranial nerve number 1, olfactory, is intact. Both nares are patent, and now we'll palpate for the frontal and the maxillary signs. Maxillary. Good. No nodule, no tenderness to palpation. We will now assess the throat and the mouth, looking at the lips, teeth, gum, the buccal the soft palate, the tongue, the floor of the mouth, salivary ducts, the posterior pharynx, and the tonsils. For this, I want you to open your mouth, move back and right to move your tongues around, to the right, up, and down. Good. All structures within the mouth are normal. The tonsils are grade 1. There is no lesions, no swelling, and no gum disease present. We will now assess for cranial nerve number 9, the glossopharyngeal, and cranial nerve number 10, the vagus nerve. For this, I want you to stick your tongue out and say, ah. Good. The tongue, the soft palate, and the uvula flow symmetrically with phonation, and I will assess cranial nerve number 12, the hypoglossal nerve. For this, stick your tongue out, go left, right, up, down. Good. Cranial nerve is number 12 is intact. The movement of the tongue was midline and symmetric with no fasciculation. We will now assess the neck. The neck is supple. Midline, the trachea is midline. I will now palpate the thyroid gland. For this, I'll scoot your trachea over to the left. I want you to swallow. Now to the right. Swallow. Good. The thyroid gland was non-palpable, no enlargement, no nodules, and no tenderness. We will now palpate the carotid artery on both sides. Good. The carotid artery is 2+ bilaterally. I will now auscultate for any bruise. I want you to hold your breath when I listen. Good. Good. No bruise noted. Now I will assess the posterior of my patient's chest. As you can see, the general appearance is symmetrical with no deformities. My patient shows no signs of respiratory distress. There is no use of accessory muscles, no tripoding, no retracting, no nasal flaring, no tachypnea, no cyanosis. I would now palpate for chest symmetry. I want you to take a deep breath. Good. Chest expansion is symmetrical. I will now palpate for tactile firmitus. Every time you feel my hand, I want you to say 99.
99. 99, 99, 99.
Good. There is equal vibration throughout the lung field. And now I will percuss in each intercostal space of the lung. There's resonance noted in all lung fields. Now I will auscultate over the lung fields. Take a deep breath for each touch. Good. 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 Lung sounds are clear in all fields. Now we'll auscultate for egophony. I want you to say the letter E with each touch.
E, 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 E.
Egophony is negative. I will now auscultate for bronchoscopy. I want you to say 99 with each touch.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Bronchoscopy is negative. Now we will auscultate for the whisper pectoriloquy. Okay, I want you to whisper 99 with each touch. Whisper pectoriloquy is negative. We will now assess the anterior part of my patient's chest. The general appearance is symmetrical. There are no deformities. I will now palpate for chest symmetry. Breathe in for me. Good. I will now palpate for tactile firmitas. Okay. Each touch, I want you to say 99.
99, 99, 99, 99.
Okay. There is equal vibration throughout all lung fields. And now we'll auscultate over the lung field. Breathe in and out each touch. Good. 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 Lung sounds are clear in all fields. Now we'll begin my assessment of the heart, auscultating over the 5 areas of the heart, starting with my diagram. Okay, the aortic is first in the second intercostal space, right sternal border. Pulmonic, second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid, fourth intercostal space, left sternal border. Mitral, left midclavicular sternal border. This is also the point of maximum intensity. There are no abnormal pulsations. The S1 and S2 are noted. There are no gallops, no murmurs, or no extra heart rhythms. The apical pulse is palpable, and now we'll listen for 1 full minute, beginning now. Heart rate is 79, sinus rhythm. I will now auscultate with the bell over the same 5 areas of the heart, starting with the aortic, pulmonic, Erb's point, tricuspid, mitral. No bruit is noted. We will now assess the JVD. I have my patient lie down and I'll assess for jugular pulsation. For this, I'll need you to lay in a 30-degree angle for me, please. Look this way. JVD is flat. Jugular pulsation is not. Jugular pulsation is non-visible or non-palpable as well. I will look for any heaves and lifts. There are no heaves or lifts noted. I will now palpate of the 5 areas of the heart: aortic, pulmonic, Erb's point, tricuspid, mitral. There are no thrills to palpation. And now we'll auscultate over the 5 areas of the heart: aortic, pulmonic, Erb's point, tricuspid, mitral. S1 and S2 are noted. There are no murmurs, no gallops, and no extra heart rhythms. Now we'll auscultate with the bell for any bruits. Aortic, pulmonic, Erb's point, tricuspid, mitral. No bruits noted. Now we will begin to assess the abdomen. For the abdomen, the contour is flat. It is symmetrical. There are no bulges, no masses. I will now begin to auscultate for any bruits, starting with the aortic. No bruit noted. Renal. No bruit noted. Iliac. No bruit noted. Femoral. No bruit noted. And now we'll auscultate for vowel sounds. Started in the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Vowel sounds are normal active. I will now percuss over the abdomen, starting in the right lower quadrant, right upper quadrant, left upper quadrant, right lower quadrant. Timpani over all vowel sounds. And now I'll percuss over the liver and the spleen. Take a deep breath. Good. There's dullness over the liver, tympany over the spleen, indicating that it is not enlarged. Now we'll palpate, starting in the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. There's no tenderness to palpation, no masses, and no deformities as well. Now we'll palpate the liver. Take a deep breath. The spleen. The liver and spleen are non-palpable. I will now assess for CVA tenderness. Any tenderness? Any tenderness? No CVA tenderness. Now we will begin our assessment for the musculoskeletal. For the musculoskeletal, we'll start with the upper body. I'm over here this way. We'll be looking at the hands, wrists, elbows, and shoulders. There is no swelling, no deformities. Structures are bilateral. There is no edema, no tenderness, no palpation, and no crepitus as well. I will start with assessing the capillary refill of the fingers. Good. Capillary refill is less than 3 seconds. I will now assess the radial pulses. Radial pulses are 2 plus bilaterally. And now we begin assessing the range of motions within the fingers. Flexion, extension, hyperextension, abduction, adduction, thumb opposition. Sorry about that. Okay, full range of motion is noted in the fingers, and now the wrist, flexion, extension, hyperextension, ulnar deviation, radial deviation, circumduction, rotation. Full range of motion is noted in the wrist, and now we will do the elbows, flexion, extension, hyperextension. Full range of motion is noted in the elbows, and now the shoulders, flexion, extension, hyperextension, internal rotation, external rotation, abduction, adduction, and circumduction. Good. Full range of motion is noted in the shoulders. Now we will test for strength grip with the hands first. 5 out of 5 for strength in the hands, and now the biceps and triceps. Pull, push. Strength is 5 out of 5 in the biceps and triceps, and now the shoulder girdle. Extend your arms, pull down, pull up. Strength is 5 out of 5 in the shoulder girdle. We will now assess for cranial nerve number 11, accessory, shoulder. Cranial nerve number 11 is intact, accessory. Now we will assess the cerebellar coordination. For this, we'll be doing a series of hand movements, starting with thumb opposition. Like that. Good, that is intact. And our hand flip-flop, pronated, started here, and then flip-flop. Good. That's intact. And now we will do finger to finger. I want you to put your index finger on your nose and come to my finger. Good, good, good. And now the other one. Good, 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 good. All right, that's intact as well. Now we will perform stereognosis. I'll place something in your hand. I want you to tell me what it is, okay? My object. Okay, close your eyes.
Rubber band.
Good.
True.
Good. Stereognosis is intact. And now we will assess for gastroesthesia. For this, I will write something in your hand. Tell me what it is.
L O L E.
Good. Graphesthesia is intact. Now we will assess the overall body. Can you look that for me? The temperature is warm. No tenderness to palpation, no deformities. Color is normal for ethnicity. There is no edema. Skin integrity is intact. Now we will assess deep tendon reflexes. I'll start with the brachioradialis. I want you to look for me. Good. Good. Now the brachio. Good. Tricep. Good. Good. Now the patellar. Good. Good. Achilles. Good. Good. Now we will assess for light sensation. I want you to close your eyes and let me know where you feel my touch.
Right arm, left arm, right leg, left foot, like that.
Okay. Light sensation is intact, and now we will do vibratory sensation using my tuning fork. I'll place it on my wrist. Let me know when you feel it.
Mm-hmm.
Good.
Mm-hmm.
Now the on the prominent.
Mm-hmm.
Good.
Mm-hmm.
Good. Now the malleus.
Mm-hmm.
Good.
Mm-hmm.
Good. Vibratory sensation is intact. Now we will begin assessing the lower extremities of the musculoskeletal. For this, there is no swelling, no deformity, no redness, no edema, no tenderness to palpation. I will begin assessing the capillary refill. Capillary refill is less than 3 seconds, and I'll palpate the dorsalis pedis, 2 plus bilaterally, posterior tibia, 2 plus bilaterally. Now we will do the range of motion for the toes, flexion, extension, abduction, adduction. Full range of motion is noted in the toes, and now the ankles. Plantar flexion, dorsiflexion, inversion, rotation. The full range of motion is noted in the ankles. And now we will test for strength. Push down, pull up. 5 out of 5, 10. 5 out of 5 strength for toes and feet. And now knees. Push out. 5 out of 5 strength is noted in the knees. And now the hips. Pull in, pull out. 5 out of 5, 10 strength is noted in the hips. I'll have you stand. Now we do full range of motion for the hips. So flexion. For the knees. Flexion, extension, hyperextension. Now the other one, flexion, extension, hyperextension. Full range of motion is noted in the knees. And now for the hips, flexion, flexion, extension, hyperextension, abduction, adduction, circumduction. And now for the other leg, extension, flexion, extension, hyperextension, circumduction, abduction, adduction. Full range of motion is noted in the hips. And now we will assess the spine. There are no abnormal curvatures, no tenderness to palpation. Lean forward. The scapula is symmetrical. There's no kyphosis, no scoliosis. Now range of motion, flexion, extension, hyperextension, lateral flexion, rotation. Full range of motion is noted in the spine. And now the cervical spine, flexion, extension, hyperextension. Full range of motion is noted in the cervical spine, lateral flexion as well. Full range of motion is noted in the cervical spine. Now we'll assess for Romberg. No swing noted. And now we will assess gait. I want you to walk to me. Now heel to feet. The gait is steady. Hop on one leg, other leg. This concludes my head to toe assessment.